This footage from January 2015 shows patients on trolleys lining the corridors of Our Lady's Hospital in Drogheda. 8 years on, little has changed. Today, the Irish Nurses and Midwives organisation is warning that a record 931 admitted patients are on trolleys waiting for a hospital bed across the country. 767 patients are on trolleys in emergency departments, along with 164 elsewhere in the hospitals. The INMO says 26 children have been admitted to hospital without a bed. The most overcrowded hospital is Limerick, where 97 patients are waiting for a bed. Yesterday, the hospital declared a major internal incident due to an unprecedented number of people attending the ED. Today, the HSE is warning the public that it's currently going through one of the busiest ever periods experienced by the health service, with long waiting times. Amid a surge in COVID, flu and other respiratory illnesses, including RSV, it's urging those in need of medical care to consider other options before attending a hospital emergency department. It says those feeling unwell or injured should first try their GP or pharmacy or a minor injuries unit. However, those seriously ill should still go to the ED. In Dublin, the Mater Hospital is also appealing to the public, where possible, to avoid its emergency department, which it says is under extreme pressure. While the National Ambulance Service says it's also experiencing a large volume of calls, urging people to be patient as it deals with the most serious injuries and illnesses first. Paul Quinn, Virgin Media News.
Right, let's get more on today's record-breaking trolley figures. Our news correspondent Zara King is at St Vincent's Hospital in Dublin for us this lunchtime. Zara, we seem to be confronting this crisis every single January in the country's hospitals. Why is it even worse this January?
Well, Colette, I suppose a lot of people working in healthcare, and particularly the INMO we spoke to this morning, will describe this as being entirely predictable. And we said this to Colin Henry, the Chief Clinical Officer of the HSE, just before Christmas. In the last interview we did with him before Christmas, could he guarantee that this wouldn't happen? And he said at that time that he couldn't guarantee that this wouldn't happen. There is a huge number of respiratory infections right across the country, and people are presenting understandably at those emergency departments. The Nurses and Midwives organisation describing conditions in hospitals as inhumane. Finlay Hay telling us today that there are examples of patients who are being asked to sleep on floors while they wait to be treated, and she says it is those long waiting times that are critical. She's saying they are the ones that will determine whether the patient's outcome is positive or negative.
And any length of stay that is longer than 6 hours on a trolley means that your health outcome is going to be worse and compromised. So you can imagine now we have waits on trolleys of 3 to 4, 5 days in some instances, patients for whom there are no trolleys available, care being delivered in the back of ambulances reported to us regularly now. I mean, all of that leads to poorer outcomes for patients, bad care, and no fault of the staff who are trying their best. Both doctors, nurses, ambulance personnel, they're doing their best. But clearly, the environment in which they're working is working directly against them. It's like pushing against this massive tide all of the time.
Well, for more on this, I'm joined now by Sinn Féin's health spokesperson, David Cunnan. David, the INMO this morning are calling for the reintroduction of mandatory mask wearing. They're saying this could really bring the situation under control within a 2-week period. What do you make of that?
Well, I think all options obviously have to be on the table. Any public health measures has to be underpinned by public health advice, so we need to hear from the CMO. But critically, I think we're in the eye of a storm at the moment in our hospitals. We're hearing about people sleeping on the floor, people sleeping on chairs, people on hospital trolleys, record numbers today. And it's a real challenge for all of those on the front line. I've spoken to many consultants and nurses and doctors over the last 24 hours and over the last few weeks, and it's the worst they have ever seen it. It is a real crisis. And I think what we need is an all-hands-on-deck approach. We need to use the private health sector capacity. Anything that can be done has to be done to ease the pressure on our public system at the moment.
Do you worry, David, about people who are being told not to present at hospital? Because that's something the INMO mentioned this morning, is that asking people not to turn up actually now is no longer an adequate strategy, because there are people who are very sick who are delaying presentations, and that's creating bigger issues down the line.
It's a real challenge for hospitals because they have huge numbers of presentations and they simply don't have the beds. We know in Limerick, for example, and other hospitals, they simply don't have the capacity. And obviously that's a big concern, because the alternative care pathways that people are being advised to take is to go to out-of-hours GP care. That's non-existent in many areas. I've been saying that to the Minister for some time. We have a real crisis in primary care and GP capacity.
OK, David Cunnan, Sinn Féin's health spokesperson, thank you very much for joining us in the news at 12:30. Colette, the INMO telling us today that they expect that this crisis will continue right up until the end of February.
All right, Zara, thank you very much for all of that.